Welcome to the Getting Healthier Together module on depression and healthy living. This video can help you understand what depression is, identify and reduce controllable risks for depression, avoid obstacles to seeking care for depression, know what treatment options are available, and create an action plan for yourself. What is depression? Depression is a serious medical illness, just as diabetes and high blood pressure are. Depression significantly impairs your thoughts and feelings and your ability to function in daily life. Depression is not just in your head, or a character flaw, or a sign of personal weakness. Everyone feels sad sometimes, but these feelings usually go away in a few days. Do you suppose that this is what is meant by depression? Take a moment to think about this. Depression is different from this occasional sadness that everyone experiences, and it can also be different from person to person. For example, symptoms of depression can start very suddenly or come on gradually over time. Symptoms of depression include feeling persistently sad, anxious, or empty, as if there's no meaningful purpose in life, feeling hopeless or pessimistic, feeling guilty, worthless, or helpless, irritability or frustration, especially over small matters, loss of interest in normal activities or hobbies, fatigue, indecisiveness, difficulty concentrating, remembering details and making decisions, being unable to sleep, waking up early or sleeping too much, a significant change in appetite or weight, recurrent thoughts of death, suicide, or attempted suicide, aches or pains, headaches, cramps or digestive problems, and crying spells for no apparent reason. Not everyone who is depressed experiences every symptom, and there are different forms of depression, including major depressive disorder, bipolar disorder, seasonal affective disorder, and postpartum disorder. A person is diagnosed with major depressive disorder when the symptoms prevent the person from functioning normally for an extended period of time. People with this disorder have 5 or more symptoms of depression every day for at least 2 weeks. One of the symptoms is either depressed mood or loss of interest in normal activities. Who do you suppose is at risk for developing depression? People of a certain race? People of a certain culture? People in a certain age group? Or all people? Please take a moment to think about your answer. The fact is that depression is a common illness, and people of all races, cultures, and ages can be affected by it. Depression is the leading cause of disability in the world, and it can be deadly. While everyone's different, and it may take time to find the right treatment, it's very important to seek treatment because even the most severe cases of depression can be treated. There's a handout available to you titled What to Do If You or Someone You Know is Suicidal, and it looks like this. Now that you know what depression is, please join us for part 2, where we'll talk about ways to reduce risks for depression that are under your control. A risk factor is a situation associated with an increased chance for something to happen. For example, being overweight is a risk that may increase a person's chance of developing a condition like type 2 diabetes. Just as there are risk factors for developing other medical conditions, there are also risk factors for developing depression. Take a moment to think about this question. Do you suppose that all risk factors for depression are under your control? Yes or no? The answer is no. Risk factors for depression that people can't control are being female, having biological relatives who have depression, experiencing stressful life events, having a severe or chronic illness, and traumatic experiences as a child. What about this question? Are there risk factors for depression that are under your control? Yes or no? The answer is yes. In fact, there are several risk factors for depression that are under our control. For example, abuse of alcohol, nicotine, or drugs can reduce the effectiveness of treatment, prolong depression, and increase the risk of side effects. A second risk factor is being physically inactive. Physical activity can reduce the chance of developing depression, especially for elderly persons. A third risk factor is not having friends or supportive relationships. Being isolated can make problems worse. Healthy relationships and a strong social network can provide the kind of support that reduces the risks. Another risk is having certain personality traits, including chronic worrying, being compulsive, having goals that can't be reached, or being extremely self-critical. A final risk factor for depression that can be controlled is taking certain medications. Be sure to talk with your doctor before stopping any medication you think may be affecting your mood. Now that you know what the controllable risks for depression are, let's talk about some ways to lower them, starting with building supportive and healthy relationships. One suggestion to lower the risks of depression is to talk with a relative or friend that you trust. Another is to confide in a counselor, therapist, or member of the clergy. Be around positive people and participate in social activities you enjoy. A final suggestion for building relationships is to get together with family and trusted friends regularly. We also have suggestions for setting realistic goals that aren't overwhelming. Try to focus on what you're able to do instead of what you can't do. Simplify your life by not taking on too many obligations. Make a daily list of a few things you want to complete that day and stay focused. Split big or complex tasks into small steps that are achievable. And postpone making important decisions when you feel down. We also have some suggestions for maintaining good overall health. Exercise regularly. Eat a healthy diet. Get plenty of sleep and establish a regular sleep pattern. Maintain personal grooming. Practice relaxation techniques. And expose yourself to a little sunlight or a light box every day. There's a handout available to you titled Tips to Reduce the Risk of Depression that you can use as a reminder for all of these suggestions. In Part 3, we'll talk about avoiding obstacles that can keep people from seeking care for depression. Sometimes obstacles get in the way of seeking care for depression. Here's a list of some obstacles people face. Not thinking you're depressed, lack of motivation, doubting whether treatments work, fear of the side effects from medications, fear of revealing personal problems, stigma, doubts about the capabilities, knowledge, skills, and understanding of healthcare professionals, fear of being institutionalized, and cost. Since getting care is so important, we'll take this opportunity to look at some strategies for overcoming obstacles. What if you aren't seeking care because you don't think you're depressed? What might be a helpful idea? Find out if you have depression. Find out whether your symptoms are caused by another condition that is not being adequately treated. Do nothing and wait to see if you feel worse. Please take a moment to think about this. The first two choices, finding out if you do have depression and learning if your symptoms are caused by another condition, are the best ideas. Waiting is not a good idea. If your obstacle to seeking care is a lack of motivation, a strategy is to make a list of questions to ask when you see a healthcare provider about depression. If you doubt whether treatments work, a strategy is to find accurate information about the effectiveness of treatments for depression from reputable sources. If you're worried about side effects from medications, a strategy is to make a list of questions to ask about the side effects that are most important to you, and then ask these questions when you see a healthcare provider. What about being fearful of revealing personal problems? Do you suppose that there are laws that protect your privacy? Yes or no? The answer is yes. There are laws that healthcare providers must follow to keep your information private. You can also use online resources. If stigma is an obstacle, it can be helpful to know that this is a common reaction. Know that depression labels are not true. Remember that depression is a medical condition that can be treated. If you have doubts about healthcare professionals, find a healthcare provider who specializes in treating people who are experiencing depression. If you have a fear of being institutionalized, one strategy is to remember that hospital or residential treatment programs are only considered if there's a significant risk to self or others. Finally, if the cost of treatment is an obstacle, it can be helpful to check with local social service agencies and your healthcare provider. There's a handout titled Tips to Overcome the Obstacles to Seeking Care for Depression that's available to you. It's a handy reminder about what we've just discussed. Now that we've talked about managing some obstacles to seeking care, what can you do to prepare for an appointment once you've decided to make it? It's a good idea to be prepared to provide as much information as possible about how you're feeling, a description of your depressed feelings, and how they affect your life, any decreased interest in doing things, any family history of depression, any medications you're taking, what things are important to you, and whether you have any thoughts of suicide. Along with the questions you're prepared to answer, there are also some important questions to ask the healthcare professional. You can ask, what is your experience in diagnosing and treating depression? How can I be sure the information I provide will stay confidential? How will you know that I'm depressed enough to justify treatment? What tests will you do? What treatment is likely to work best for me? What are other options for treatment? If you prescribe a medication, how long will it take for the medication to work? What are the likely side effects of medications or treatments that you would suggest for me? What can I do if I'm concerned about the cost? And will you give me some written information about the treatments we discussed that I can take with me? It's a good idea to have these questions written down before you go to your appointment. In Part 4, we'll be talking about different options for treating depression. What are the different ways to treat depression? Even the most severe depression can be treated. Do you suppose that the timing for when a person begins treatment makes a difference? Yes or no? The correct answer is yes. Timing is important because the earlier treatment begins, the more effective it is. The first step is to visit a doctor or mental health specialist. If the physician can't find a medical condition that may be causing the depression, the next step is psychological counseling. One form of treatment is psychotherapy, which is sometimes called talk therapy. A licensed mental health professional helps people with depression focus on behaviors, emotions, and thought patterns that contribute to depression. They also help the depressed person identify and understand life problems that contribute to their illness so they can regain a sense of control. Cognitive behavioral therapy is the most common form of psychotherapy for depression, but there are many other types. Talk with your doctor or healthcare professional to decide which treatment option is best for you. The American Psychiatric Association treatment guideline supports the approach of using psychotherapy for persons with mild to moderate depression. But the association also notes that a combination of psychotherapy and antidepressant medications may be more appropriate for individuals with moderate to severe depressive disorder. A second form of treatment for depression is medication. Antidepressant medications are commonly used to treat depression and primarily work on chemical messengers in the brain that help regulate mood. The three primary messengers involved with depression are serotonin, dopamine, and norepinephrine. When the levels of these messengers are low or not properly balanced, depression may occur. A family doctor can prescribe medications for depression or provide a referral to a psychiatrist. Everyone is different, and finding the right medication or treatment combination will likely take some trial and error. Alternative treatments are a third form of treatment for depression. Alternative treatments can sometimes provide relief that traditional Western medicine cannot. Some examples of alternative treatments are acupuncture, guided imagery, chiropractic treatments, yoga, hypnosis, biofeedback, aromatherapy, relaxation, herbal remedies, massage, music therapy, dance movement therapy, and many others. A fourth form of treatment for depression is electroconvulsive or ECT therapy. An electric current is used to produce a seizure in the patient. It's believed that ECT results in the release of chemicals in the brain that aid communication between nerves. This is used for severe forms of depression, particularly when antidepressant medications have not worked, and when there is a high risk of suicide. The important thing to remember is that there are many forms of treatment for depression. In Part 5, we'll explain how you can use a personalized action plan for depression and healthy living. An action plan is like a roadmap. It turns the decisions you make about what you want for yourself into practical steps for getting where you want to go. There's an action plan for depression and healthy living handout that's available to you, and it looks like this. You begin using the plan by reading through each of the choices to see which ones might interest you most. The choices on the action plan are organized into sections including Get the Facts About Depression, Get information about treatment options from your healthcare provider, Continue with your prescribed therapy, Maintain and build healthy relationships, Take care of yourself and stay physically active, and Simplify your life. The idea is to choose the action items that you want to do. You can also write in your own goals in the other section of the handout. You may be tempted to check off a lot of the boxes in the list, but it's better to start off with just one or two. Lifestyle changes are made one step at a time. If you're overwhelmed with too many changes at once, you are less likely to reach your goals. You can always add more goals later as you continue making changes that move you towards the better and healthier life you want. When you're finished making your choice, there are 4 questions for you to ask yourself based on what you selected. You've already answered the first question, which is, what behavior would I like to change, based on which checkboxes you've selected. The second question to ask yourself is whether you believe it's possible for you to do the things you've selected. Answer with a yes or no. The third question to ask yourself is, what must I do to achieve this change? Make sure that you identify a specific action that goes with what you want to change. For example, if you choose that you want to prepare a written list of questions to ask your healthcare provider, decide when you will begin preparing the list. Write your method for measuring whether you've reached your goal in the space provided on the action plan. Deciding how you'll measure your success is a very important part of this process. The fourth question is, when will I make these changes? Think about how long you think it'll take you to make this change in your life, then write the date for when that'll be in the space provided. The last step for creating your personalized action plan is to select your confidence level for making the change you've decided to make. To do this, select a number from 1 to 10 for how confident you feel that you'll follow your action plan. A confidence level of 10 would be the most confident, and a 1 would be the least confident. If your level of confidence is lower than 7, think about choosing something else on the action plan, or maybe giving yourself a little more time to make the change. There's one final handout that's available to you, and it's called Depression: What You Need to Know. The handout has a summary of the key points from this video, and we hope it'll be useful to you. Thank you for your time and for participating in getting healthier together.